I was involved in a car accident, a serious car accident when I was 22, and it really turned my life around from not knowing exactly what I wanted to do to really moving into healing, personally and professionally. And so I got into the mind-body therapies, and I saw right away that the body could be a direct means for healing. And so I enrolled in chiropractic school, went through chiropractic school, and after I got out, I studied with different osteopaths. And I started to learn about the history of craniosacral therapy, it was discovered in the 1920s by an osteopath named William Sutherland, who actually, these bones, can you see these bones here? These are what's called bones from a disarticulated skull. It means the skull was, these are your actual parts of your head, and so of cranial bones. And Dr. Sutherland, in looking at this disarticulated skull, he looked at this bone in particular. This is called the temporal bone, and he could see an inner beveling of the temporal bone, and a thought came to him, which was to change his life. A thought came to him which said, beveled like the gills of a fish, which designed for primary respiration. It just came to him out of the blue. And what he realized that these sutures, you could see the irregularity of these sutures, is designed for small degrees of motion. In other words, this is a living, breathing entity, your skull. It's not a fixed thing as they teach in Western medicine. Actually, Eastern anatomy books used to show that the skull was movable. But as we got into Western anatomy, they said it was fused. Well, he looked at the architecture of the skull and he realized this is designed for motion, for movement. And so he experimented on himself. He did direct kind of listening into himself, and he saw that as he tightened the screws of this helmet he was wearing, he produced different symptoms. This is why I finally said, you got to stop this. This has gone far enough. But out of that, he formed this approach to cranial therapy. Cranial, it was part of osteopathy at the time, cranial osteopathy. And at first it was very biomechanical orientation because he was an osteopath, so he labeled it sort of flexion, extension of the bones, or internal, external rotation. But then, towards the end of his life, he had a very amazing experience with a man dying at his bedside, and he felt this sort of this wave, this presence in the field of the patient and their loved one and his immediate loved ones that sort of seemed to carry the patient to the hereafter. And he realized that there was something more at play, even within the human system, what he called a biodynamic approach. In other words, what he called the breath of life, actually, which is this universal intelligence that can be basically palpated and sensed in the person. It's sort of what gives intelligence to every living, breathing thing. And through subtle listening skills, he could listen in and sense this breath of life. In other words, this breathing going on in all the tissues of the body. This breath of life produces a series of subtle rhythms that can be palpated, and it carries an essential ordering principle for the body and mind. In other words, it's a conveyor of the intelligence that lives in the human system. So it's like saying, within us, there is this life force that produces palpable rhythms that a skilled practitioner can feel, and can feel where there's interference to these rhythms. And that's where we have what's called inertial forces. In other words, we have these biodynamic forces I just described, and then we have inertial forces. Inertial forces are conditional forces when you have a physical injury, when you have an emotional stress, when you have a birth trauma, when you have toxicity. It affects the rhythmic movements of the breath of life. So the goal of the practitioner is to help restore these trapped forces that underlie patterns of disease and fragment the body-mind. And so my work as a practitioner is, first of all, to be present for the person. Because in being present, I offer this reflection, this reflecting field for the person to come into their own self-healing, their own self-correction. Much like if you think about a mother, how she attunes to her infant and can just, she's not too invasive, she's not too distant, she just attunes perfectly or to the best of her ability, just good enough to allow the infant to grow and develop. So I'm doing the same thing. I'm being a presence to your kind of healing system's ability, your body's ability to heal itself, and allow the breath of life within itself, within your body, to do the work. And so basically, I'm forming a relational field. That's a very key concept. I'm forming a relational field with you where I can allow this sort of witness consciousness to come into play in your system that allows your system to heal, whether it's physical or emotional. What you will feel is a slowing yourself down, coming back into your body, feeling grounded, centered, focused, calm, achieving mental clarity again. That's what it feels like as you leave a session. And your nervous, immune, and hormonal systems are all strengthened. They all kind of, one affects the other. So as your nervous system comes into play more, these other systems are affected. This is suitable for people of all ages, babies, children, the elderly, acute and chronic cases. So I found this to be tremendous healing for myself from my own earlier car accident. And I really want to reach out to young athletes today who are suffering with concussions. I feel this is a very missed modality. I feel that concussions, are being diagnosed much better, but the actual treatment for them is not all that advanced. This is something that really could be useful to allow these compressive forces to leave the body. Even 20, 30 years later, they can still leave the tissues of the body and allow the body to, this natural respiratory movement throughout the body to come back into play. I've experienced, I've seen other people experience it.